Hi, my name is Tamara Leek, and I will be discussing breast cancer. About breast cancer. Breast cancer is a type of cancer that starts in the breast. It can start in one or both breasts. Breast cancer is a malignant tumor that starts in the cells of the breast. It results from damage to the DNA and genetic mutations of cells, which can lead to breast cancer. Cancer starts when cells begin to grow out of control. Breast cancer occurs almost entirely in women, but men can get breast cancer too. It is important to understand that most breast lumps are benign and not cancerous, non malignant. Breast cancers can start from different parts of the breast. The breast is an organ that sits on top of the upper ribs and chest muscles. There is a left and right breast, and each one has mainly glands, ducts, and fatty tissue. The breast has different parts, including lobules, that are the glands that make breast milk. Cancers that start here are called lobular cancers. Ducts are small canals that come out from the lobules and carry the milk to the nipple. This is the most common place for breast cancer to start. Cancers that start here are called ductal carcinomas. The nipple is the opening in the skin of the breast where the ducts come together and turn into larger ducts so the breast milk can leave the breast. The nipple is surrounded by slightly darker, thicker skin called the areola. A less common type of breast cancer called Paget's disease of the breast can start in the nipple. Cancer, breast cancer can spread when the cancer cells get into the blood or lymph system and then are carried to other parts of the body. The lymph or lymphatic system is a part of your body's immune system. It is a network of lymph nodes, ducts, or vessels and organs that work together to collect and carry clear lymph fluid through the body's tissues to the blood. The clear lymph fluid inside the lymph vessels contain tissue byproducts and waste materials, as well as immune system cells. The lymph vessels carry lymph fluid away from the breast. In the case of breast cancer, cancer cells can enter those lymph vessels and start to grow in the lymph nodes. Most of the lymph vessels of the breast drain into lymph nodes under the arm called the axillary lymph nodes. The lymph nodes inside the chest near the breastbone called the internal mammary lymph nodes. The lymph nodes around the collarbone called the supraclavicular and infracurricular lymph nodes. If cancer has spread to your lymph nodes, there is a higher chance that the cells could have traveled through the lymph system and spread or metastasized to other parts of your body. Still, not all women with cancer cells in their lymph nodes develop metastasis, and some women with no cancer cells in their lymph nodes might develop metastasis later. Clinical manifestations of breast cancer. At first, breast cancer affects the breast only. You may notice changes in your breasts themselves. The early effects of breast cancer can depend on the exact type of breast cancer you have. Breast cancer usually starts in one breast. a newly formed mass or lump in your breast. The mass or lump is usually irregularly shaped and painless. You may notice your breasts have changed color or size. They may also be red or swollen from the cancerous tumor. While breast cancers themselves aren't usually painful, the resulting swelling can cause breast pain. The cancerous lumps may still be painful in some cases. With breast cancer, your nipples may also undergo some noticeable changes. Breast cancer is broken down into stages. Stage 0 is the earliest stage with the fewest noticeable symptoms. Stage 4 indicates the cancer has spread to other parts of the body. If breast cancer spreads to other parts of the body, it may cause symptoms in those particular areas too. Affected areas may include the liver, lungs, muscles, bones, and the brain. The earlier effects of breast cancer can depend on the exact type of breast cancer you have. Breast cancer usually starts with one breast. Types of breast cancer. There are many types of breast cancer. The type is determined by the specific kind of cells in the breast that are affected. Most breast cancers are carcinomas. The most common breast cancers, such as ductal carcinoma in situ and invasive carcinoma, are adenocarcinomas, since the cancers start in the gland cells in the milk ducts or lobules. Other kinds of cancers can grow in the breasts, like angiosarcoma or sarcoma, but are not considered breast cancer since they start in different cells of the breast. Breast cancers are also classified by certain types of proteins or genes each cancer might make. After a biopsy is done, breast cancer cells are tested for proteins called estrogen receptors and progesterone receptors, and also the HER2 gene and protein. The tumor cells are also closely looked at in the lab to find out what grade it is. The specific protein found in tumor grade can help decide the stage of the cancer and treatment options. Staging of breast cancer. After someone is diagnosed with breast cancer, doctors will try to figure out if it has spread, and if so, how far. This process is called staging. The stage of cancer describes how much cancer is in the body. It helps determine how serious the cancer is and how best to treat it. Doctors also use a cancer stage when talking about survival statistics. The earliest stage breast cancers are stage 0, carcinoma in situ. It then ranges from stage 4 through stage 5. As a rule, the lower the number, the less the cancer has spread. A higher number, such as stage 4, means cancer has spread more. And within a stage, an earlier letter means a lower stage. Although each person's cancer experience is unique, cancer with similar stages tend to have a similar outlook and are often treated in much the same way. The staging system most often used for breast cancer is the American Joint Committee on Cancer TNM system. The most recent AJCC system, effective January 2018, has both clinical and pathological staging systems for breast cancer. The pathological stage, also called the surgical stage, is determined by examining tissue removed during an operation. Sometimes, if surgery is not possible right away or at all, the cancer will be given a clinical stage instead. This is based on the results of a physical exam, biopsy, and imaging tests. The clinical stage is used to help plan treatment. Sometimes the cancer has spread further than the clinical stage estimates and may not predict the patient's outlook as accurately as the pathological stage. In both staging systems, 7 key pieces of information are used: the extent or size of the tumor, which is characterized by the letter T, how large is the cancer, has it grown into nearby areas, the spread to nearby lymph nodes is characterized by the letter N. Has the cancer spread to nearby lymph nodes? If so, how many? The spread or metastasis to distant sites are characterized by the letter M. Has the cancer spread to distant organs such as the lung or liver? Estrogen receptor status. Does the cancer have the protein called an estrogen receptor? Progesterone receptor status. Does the cancer have the protein called a progesterone receptor? HER2 status. Does the cancer have the protein called HER2 status? Details of the TNM staging system are numbers or letters after T, N, and M provide more details about each of these factors. Higher numbers mean cancer is more advanced. The categories for the use of the pathological or surgical definitions: categories for breast cancer. T followed by a number from 0 to 4 describes the main primary tumor size and if it has spread to the skin or to the chest wall under the breast. Higher T numbers mean a larger tumor or wider spread to tissues near the breast. N categories for breast cancer. N followed by a number from 0 to 3 indicates whether the cancer has spread to lymph nodes near the breast, and if so, how many lymph nodes are involved. Lymph node staging for breast cancer is based on how the nodes look under the microscope and has changed as technology has gotten better. Newer methods have made it possible to find smaller and smaller groups of cancer cells, but experts haven't been sure how much these tiny deposits of cancer cells influence outlook. It's not yet clear how much cancer in the lymph nodes is needed to see a change in outlook or treatment. M categories for breast cancer. M followed by a 0 or 1 indicates whether the cancer has spread to other organs or has metastasized. Risk factors for breast cancer. A risk factor is anything that increases your chances of getting a disease, such as cancer, but having a risk factor, or even many, does not mean that you are sure to get the disease. While you can't change Some breast cancer risk factors, like family, history, and aging. For example, there are some risk factors that you can control. A risk factor is anything that increases your chances of getting a disease, such as breast cancer. But having a risk factor, or even many, doesn't mean that you're sure to get the disease. Drinking alcohol is clearly linked to an increased risk of breast cancer. Being overweight or obese after menopause increases breast cancer risk. Women who have not had children or who had their first child after age 30 have a slightly higher breast cancer risk overall. Some birth control methods use hormones, which might increase breast cancer risk. Oral contraceptives, most studies have found that women using oral contraceptives or birth control pills have a slightly higher risk of breast cancer than women who have never used them. Menopausal hormone therapy with estrogen has been used for many years to help relieve symptoms of menopause and help prevent osteoporosis. This treatment also goes by other names, such as postmenopausal hormone therapy and hormone replacement therapy. There are two main types of hormone therapy for women who still have a uterus. Doctors generally prescribe estrogen and progesterone. Progesterone is needed because estrogen alone can increase the risk of cancer of the uterus. Estrogen therapy. Studies of the use of estrogen alone after menopause have had mixed results. Some have found a slightly higher risk, while others have found no risk at all, or even a slight decrease in risk. Breast implants have not been linked with an increased risk of most common types of breast cancer. Getting older or inheriting certain gene changes. About 5 to 10% of breast cancer cases are thought to be hereditary, meaning that they result directly from gene changes or mutations passed on from a parent that has BRCA1 or BRCA2. The most common cause of hereditary breast cancer is an inherited mutation in the BRCA1 or BRCA2 gene. It is important to note that most women who get breast cancer do not have a family history of the disease, but women who have close blood relatives with breast cancer have a higher risk. Having a first degree relative, mother, sister, or daughter with breast cancer almost doubles a woman's risk. Having two first degree relatives increases her risk by threefold. Women with a father or brother who has had breast cancer also have a higher risk of breast cancer. A woman with cancer in one breast has a higher risk of developing a new cancer in the other breast or in another part of the same breast. Women who were treated with radiation therapy to the chest for another cancer, such as Hodgkin's or non Hodgkin's lymphoma, when they were younger, have a significantly higher risk for breast cancer. This risk depends on their age when they got radiation. The risk is highest for women who had radiation as a teen or young adult when the breasts were still developing. Radiation treatment in older women after about age 40 to 45 does not seem to increase breast cancer risk. A great deal of research has been reported and more is being done to understand possible environmental influences on breast cancer risk. Chemicals in the environment that have estrogen like properties are of special interest. For example, substances found in some plastics, certain cosmetic and personal care products, pesticides, and PCBs or polychlorinated biphenyls seem to have such properties. Some studies have found that heavy smoking over a long time might be linked to slightly higher risk of breast cancer. In women who work at night, such as nurses on a night shift, might have an increased risk of breast cancer. Diagnostic testing for breast cancer. Diagnostic testing associated with breast cancers are breast ultrasound, a machine that uses sound waves to make pictures called sonograms of areas inside the breast, diagnostic mammogram, breast magnetic resonance imaging or MRI, and surgical biopsy. It's important to keep up with mammograms and other types of breast screenings as recommended by your doctor. Imaging tests can detect breast cancer before you even have any symptoms. This can speed up your treatment and create a more positive outcome. Also, genetic counseling and testing is available. Complications of breast cancer. These long term and late side effects may include fatigue, headache, pain and numbness called peripheral neuropathy, dental issues, lymphedema, musculoskeletal symptoms as in bone loss and osteoporosis, heart problems, new cancers, cataracts, blood clots, absence of menstrual periods, menstrual or menopausal symptoms, sexual difficulties, infertility, concerns about memory loss and cognitive function called chemobrain, and death. If you decide to be tested and a gene change is found, this might affect your decision about prophylactic treatment to help lower your risk for breast cancer or find it early. Medicines such as tamoxifen and relaxifene block the actions of estrogen in breast tissue. Tamoxifen might be an option even if you haven't gone through menopause, while relaxifene is only used for women who have gone through menopause. Other drugs called aromatase inhibitors might also be an option for women past menopause. All of these medications can also have side effects, so it's important to understand the possible benefits and risks of taking one of them. For the small fraction of women who have a very high risk of breast cancer, such as a BRCA gene mutation, surgery to remove the breast, prophylactic mastectomy, may be an option. Another option may be to remove the ovaries, which are the main source of estrogen in the body. While surgery can lower the risk of breast cancer, it can eliminate it completely, and it can have its own side effects. Before deciding if any of these options might be right for you, talk with your healthcare provider to understand your risk of breast cancer and how much these approaches might affect your risk. For women at increased risk who don't want to take medicines or have surgery, some doctors might recommend close observation. This approach might include more frequent doctor's visits, such as every 6 to 12 months, for breast exams and ongoing risk assessment, starting breast cancer screening with yearly mammograms at a younger age, also possibly adding another screening test such as a breast MRI. While this approach doesn't lower breast cancer risk, it might help find it early when it is likely to be easier to treat. Treatment of breast cancer also consists of a combination of surgical removal, an operation where the doctor excises the cancerous tissue, radiation therapy, and medication to treat the microscopic cancer that has spread from the breast tumor through the blood. Chemotherapy is using special medications to shrink or kill the cancer cells. Hormone therapy blocks cancer cells from getting the hormones they need to grow. Lastly, targeted therapy, also called biological therapy, is the name given to a group of drugs that block the growth and spread of cancer. They target and interfere with processes in the cell that help cancer grow. The type of targeted therapy you're offered will depend on the features of your breast cancer. Now, this is a video describing the signs and symptoms of breast cancer.
Hi everyone, welcome back to Dr. O'Donovan, Medicine Made Easy. In today's video, we're going to be looking at 7 different clinical signs of potential breast cancer. There's going to be lots of different clinical photos and diagrams, so please stick around to the end of the video. In this first photo that we're going to look at, the first important sign that you should be aware of is a new lump or thickened breast tissue. And you can see this lady here has a potential breast lump. Now, it's important to note that not all breast lumps are cancerous. However, if you do notice a new lump or a different lump when you're checking your breasts, you should go and see your nearest healthcare provider who can do a thorough examination as well as take a history from you. The second important sign to look out for is a change in shape or size of one or either of the breasts. Now, this is important because this could indicate a potential breast cancer, and you may notice this more when you move your arms or when you're getting dressed. The third thing to look out for is fluid discharge from either nipple. Now, in this diagram here, you can see that the discharges are bloody in nature. Now, it doesn't necessarily need to be bloody, so if you do notice a new discharge of any colour from the nipple and you're not breastfeeding or lactating, then you should go and see your nearest healthcare provider, who again can examine you and do a thorough history to try and investigate what the cause might be. And that's because one of the potential causes of a fluid discharge from the nipple is a potential breast cancer. Now, the fourth thing to look out for are changes in the armpit, especially and specifically lumps. So if you're examining your armpits and you notice a new lump there that you haven't felt before, don't hesitate to go see your doctor, who can again do a thorough examination if necessary. The fifth sign to look out for is puckering, dimpling, a rash or redness of the skin surrounding the breast tissue. So one thing that you notice here are these small little dots, and this is something known as peau d'orange. Now, that's French for orange peel, and if you imagine an orange, you can imagine it looks slightly like an orange skin with these little dimplings or dots. Again, if you notice this, don't hesitate to see your nearest doctor or clinician who can assess you. The sixth sign to look out for is a rash, redness, scaling, or eczema around the nipple. This photo here demonstrates something called Paget's disease of the nipple, and you can see here this sort of scaling and rash around the actual nipple itself. However, do look out for this rash, redness, scaling, or eczema in the areola region, which is the region surrounding the actual nipple itself. And again, if you do notice anything that looks different, or you're slightly suspicious of that or worried, don't hesitate to contact your nearest healthcare provider. Finally, the seventh important sign to look out for are changes of the nipple. In this photograph here, you can see inversion of the nipple. And if you do notice anything like this, don't hesitate to see your nearest doctor, who, as I've mentioned before, will make sure they do an important and thorough history and examination. I'd like to finish the video by mentioning that these signs, although mainly found in women, can also affect men, and that's because men can get breast cancer. If you are a man who's watching this video and you have any concerns, please don't hesitate to contact your general practitioner or family medicine doctor. I've included lots of useful links in the description box of this video, including websites discussing other signs and symptoms of breast cancer, what to do if you have any concerns, as well as information about the UK breast screening programme, which, if you're eligible for it, I would strongly encourage you to take part. Thank you again for watching. If you enjoyed this video, please do give it a thumbs up, leave me a comment in the comments section below, and subscribe to the channel for new videos which I publish every Wednesday and every Sunday. And until next time, thanks for watching and goodbye.
This concludes my discussion on breast cancer. My references are the American Cancer Society, Breast Cancer Signs and Symptoms, and the Center for Disease Control and Prevention, which are the symptoms of breast cancer. Thank you.